Chaplaincy everywhere. Recognising World Mental Health Day, we invited chaplaincy and well-being practitioners to gather together, recognising we are better together to support our chaplaincy contexts and offer crucial self-compassion care. It is now great to offer this recording of the webinar as we approach Interfaith Week.
Great, thank you, David, and hello, colleagues. It's a very impressive spread of chaplaincy across the United Kingdom, and just listening to you all introduce yourselves demonstrates how broad the reach you have and actually how diverse the settings you work are in. So I'm Justin Varney, I'm the Director of Public Health for Birmingham City Council. For those of you who've not come across Director of Public Health before, in normal times our job is to protect and improve the health and well-being of the populations we're responsible for. In general, every local authority has one of us. We used to sit in primary care trusts, and then we moved across around 2013. And in normal times, we're responsible for things like commissioning sexual health services, drug and alcohol services, and a tiny part of our jobs is responding to things like TB cases and outbreaks of measles or mumps. However, COVID fits in that responsibility of what's called health protection, and pretty much since February, COVID has consumed most of my life, my working life, much of my non-working life actually, as I've tried to navigate Birmingham and a city of 1.2 million people through this pandemic and save as many lives as we can, both in the short term and in the long term. So I'm going to touch on a couple of areas as kind of my opening comments for today's session, to help you in your reflections as you go through. COVID, I mean, this word unprecedented gets used a lot, but in my profession we train for pandemic, and we do tabletop exercises, and often this is about some form of flu, which is the most common form of pandemic. But the reality is that very few of us actually see it and ever experience it in our lifetimes. And I don't think there's anyone alive actually who's experienced this level of societal disruption in the public health roles that we hold, all seen this level of lockdown, and we haven't seen this level of societal shift really since the World Wars, and the impact that it's had on people's interaction, and particularly on their ability to come together and connect with each other. And when we think about COVID, you know, there are kind of tiers of layering of the impacts of COVID. There is the layer of whether you catch the infection or not, whether it puts you in hospital or not, and whether you die or not. There's the layering of that of how it spreads in your friends and family. And then there's the layering of the impact of the restrictions that they have on how we see people and how we exchange love and friendship without being able to touch people, and actually for large periods of time not being able to physically see people. And although it's lovely to see so many of you through this Zoom call and see your faces, it's definitely not the same as being in a room with you and interacting face to face. And I think the role of chaplaincy in this space has been really undervalued and underseen. And you know, David, as he said, we've sat on many calls together, and the chaplaincy across Birmingham have been very involved in some of the response to the Nightingale hospitals, for example, but also quietly behind the scenes, often unseen, providing support. And I think as a sector, as a group, you have two kind of faces. You have one which is inward facing to the staff of the organisations that you work with, and one which is outward facing to the clients and to the public interaction with that service. And they're really important dimensions which are relatively unique and slightly different from, for example, from a faith leader in a church or a synagogue or a temple, where the congregation comes to them. You're in the space in which you have a congregation or constituency who are around you but aren't coming together in the same way that they might do for congregational prayer or worship, and that gives you a unique opportunity in a space to interact. And I think through this that the interaction space has evolved. We've gone through periods in which we were faced with challenges of many people dying and the issues of bereavement, but also those issues of fear as we faced a virus that was brand new in the world, didn't appear actually until December last year. And it's so easy to forget that we've only been in this now for about 10 months. This is still a very new virus, very new disease, and it's still, we're still learning and developing how to respond to it. And we're moving through a phase now where I think the asks of you are moving from those initial bereavement, illness components to now how to support people who are exhausted, to people who have worked all the hours that are sent over the last 6 months to keep their organisations moving forward, to support patients, to support citizens and clients, and are suddenly waking up and going, it's not stopping. There isn't, we all thought there was going to be this kind of pause period where we have 1 or 2 months to breathe and relax and regroup before the second wave, and that's not the case. The second wave is already here. So I think there are some real challenges about how you, not only for yourselves, but also for those that you work with, reflect in that space that, we've all just done a marathon over a mountain, and we've just been told, actually, no, you keep going, and there's another mountain range you've got to get through, and you've just got to keep going. There isn't really a chance to stop. And I think that's where chaplaincy has a real opportunity in a space to provide that support, to provide that reflection space to individuals, to give them a safe space, which is not therapy, which often people label and won't go to. And we see very often people only step forward for help when they're absolutely on their knees. And I think the space that chaplaincy has to be that quiet shoulder, that quiet nudge that says, are you okay, is incredibly important. And David shared with me some of the stories of colleagues who have been reaching out to senior leaders and just touching base. And I have to say, in Birmingham, one of the things I've been most grateful for is some of the faith leaders and who've just reached out occasionally, just sent a text message going, are you okay today? Just thinking of you. Here if you want to have a chat. And that means so much when you're in a position like mine where sometimes you wake up and the whole weight of the world is on your shoulders, and you look at the numbers and go, I'm running out of ideas about what else I can do, and the numbers of deaths and the numbers of cases keep rising. That actually someone reaching out in that moment is incredibly important, and I think it is that support to leaders is a really important space, I think, for chaplaincy across the country at the moment, because it is very hard when you're in a leadership position to go, I'm struggling, and I'm having these moments of doubt, and I'm having these moments where it is overwhelming. We all have them. I don't think anyone doesn't. I think if they say that, they're lying. But it is very hard to talk about them. And it's very hard to find a safe space to be able to talk about them and share. And David knows, I talk probably more than many other leaders about the challenges of leadership during this time. But you will see it in your organizations. You will know people, and you will also be aware of some of the subtle signs, those leaders that start to get a little bit shorter in their reactions to staff. And you won't see it necessarily directly from them, but you will see it in your conversations with other staff, and being sensitive to those points, I think, is really key. The final bit I want to touch on is some reflections on crisis. You will have trained and have thought about crisis response and what is the role of chaplaincy in a crisis. And most of us, when we do this, think about a crisis, about something, it's kind of big bang. It happens and today, and when then we've got a recovery period over a couple of weeks or a couple of months or even a couple of years if it's a major incident. Very few of us have ever conceptualized a crisis that just goes on and on and on and on. And in thinking about it in that way, taking the thinking about how your role and your reaction, your response to crisis works in both the short, the medium and the long term, I think is important to reframe and help you structure your approach, because there will be acute crises that will continue through this. People who lose loved ones to COVID, and we will see deaths rise, unfortunately, I think, over the coming weeks and months, sadly. The medium-term crisis of people going off, the increasing workload, the sickness absence, all of those things connecting and just compounding. And then that long-term crisis, which is created by everyday continued levels of stress and the pressure that that's creating on people where there isn't an opportunity to relax. Some of you, I'm sure, will work with emergency services and armed forces who are very much better at this than many of us in the public sector, because they're good at rotating people in and out. And actually standardizing roles in a way which supports it. But you'll be very conscious in whether your organization is retail or local government. There are some people that can't be switched off, that don't get to switch out. And those are the ones that I would really say keep an eye on. So in closing, I would say, first of all, thank you. You guys are very much hidden heroes. I've seen firsthand in my own organisation how important chaplaincy has been to individuals, providing a safe space for people, and whether that's been providing support through mindfulness sessions, through discussion groups, through one-to-one support. It is essential part of keeping people going in this difficult time. And then the final point is to say, remember to look after yourselves during this. It's very easy for me to say, these are the asks of you, and that will be something we'll be discussing through the session. What are the key actions that each of you can take in your own organisations to help over the coming days, weeks and months as COVID continues? But one of those has to be also, how are you looking after yourself and looking after each other? Many of you are sole practitioners. You are the only chaplain for your organisation, and actually coming together in a group like this is so powerful and so important. But thank you for everything you're doing, and I hope those are helpful words to frame the discussion today.
Thank you so much, Justin. We're now going to move 120 people into breakout rooms with our keynote speakers and other leaders. This is the first breakout room of 2. Please bear with us for a moment. Thank you.
Thank you, David. And first of all, thank you for colleagues for being so honest and open in your sharing with each other. I think everything that I've heard reinforces the importance of chaplaincy, reinforces the importance of talking to each other during this period so that no one becomes an island or isolated, and the importance of sharing those really simple tips, and whether that's simple tips about how to get a second chip in your phone so it's not your personal number that's also your work number, or how to manage getting physical activity into your day. There are lots of things in which we can all help each other just stay strong and be honest about the reality of the situation we're working in. And I think that's my kind of final recollection or key point for today, is during times like this, what is most powerful is authentic honesty.
Yes.
Being honest about how difficult it is, not trying to paper over the cracks, but being real and authentic that there are cracks and we're all doing the best we can. And alongside that comes the compassion, which is so important to mental health and well-being. and to your role as chaplains in the many organisations that you work with. And I'm very grateful for the support and the honesty you've shared today. So thank you.
Thank you, Justin. Thank you.